On the next breath in, gently lift your chin. On the breath out, lower your chin towards your chest. So we're going to start with the spine this morning. Inhaling, lift the chin up. Exhaling, lower the chin down. And throughout your practice this morning, I'm going to ask that you move slowly. And just when you think you're moving slowly, see if you can move just a little bit slower. And you're going to try to match your breathing with your body movements. So when you're inhaling, you're opening your chest, so your chin should be rising. Give the chest a full opening, the full inhalation, and on the exhalation, you gently bring the chin down, and you can round a little bit to squeeze the air out of the body. A full breath in and a full breath out. And so now we got the neck warmed up a little bit. On the next exhale, go ahead and hinge from your hips and lean forward. As you lean forward from your hips, try to relax your inner thighs. Relax your legs and your hips as much as possible. And once you get the furthest you can forward, try to elongate out of your hips, and you can isometrically pull yourself with your arms there. Like this, pulling yourself with your arms forward. Lift up a little bit, and come back down. Breathe into your movement here. So as you breathe, relax, and maybe a slight undulation side to side, looking for any tight spots. Again, you're trying to move slowly here. When you find a tight spot, maybe pause there and breathe into it. Full breath in, breathe and relax into the stretch here. Find sensations. So you're breathing, you're relaxing, you're feeling. So you want to feel in your body where the tightness is. Start to migrate over to the right here. So gently walking your body over to the right, find a tight spot, pause there, take a deep breath in, breathe, relax into the stretch. Feel where the tightness is. Maybe it's in the right hip, just below the rib cage. If it is, pause there. Acknowledge where that is internally, and you might feel that dissipate, and if you do, then you can take it a little bit further. Eventually trying to elongate your torso out over the right leg. Continuing to relax your knees down towards the floor, relax your inner thighs. Maybe inhale, take yourself up a little bit, elongate, and hinge down over. And if at any time, of course, if you have a question, unmute yourself. You can bring yourself back onto the screen, and we can talk about it if you'd like. Inhale, lengthen, exhale, hinge. Elongate. Again, isometrically pull with your arms. Push yourself back up, and let's move over to the other side very gently, walking yourself over to the left. Inhale, lengthen, exhale, hinge. Inhale, lengthen, exhale, hinge. Tucking your chin, allow the back and the neck to get a nice stretch here as you elongate and melt down over the left leg. You're breathing into sensations. Breathe, relax the body, relax the mind. Feel what's happening in your body. Give extra attention to any tight spots. Allow. So you're breathing, you're relaxing, you're feeling. You're also allowing the mind to do its thing this morning as you wake up. Creating thoughts, but then letting them go. And allow the mind to do its thing. Be compassionate as we work on bringing our focus to the breath. So this is kind of like a meditation in motion here. Full breath in and out, eventually bringing yourself upright. Feel your hips maybe a little more open. Maybe drawing a big circle with your shoulders. With the mind's eye, you kind of want to peer inward and see where all these tight spots are. Let's get more into the spine now. So from the seated position, go ahead and move into a table position. So onto your hands and knees. From this table position, your hands are going to be directly over your shoulders. Knees directly beneath the hips, table position. Move into a cat and dog on the inhalation. So just like as when we were in the seated position for the neck, on the inhalation, you're opening your chest, lifting your tailbone. On the exhalation, you're rounding your back, tucking your tailbone. Try to keep your hands wide, flat, and open on the floor. Notice the base of the fingers if they want to curl up. See if you can stretch the hands out, stretch the forearms out as you move from cat to dog or cat to cow, whatever you like to call it. Tucking and rounding. As you tuck and round, try to lift the middle of your back up towards the sky. Press your hands flatly into the floor. Squeeze your navel towards the spine. You're going to continuously move from cat to dog. I might pause, but just ignore what I'm doing unless you're taking tips. But when I pause, you can keep going, moving from a full flexion in your spine to a full extension. Right? You're lifting the chin, you're lifting the tailbone, you're pressing your belly down towards the floor so that you have a nice arch in your back. Trying to find all those little spots that don't want to move. Usually it's in the mid-back area. The upper thoracic a lot of times is really hard to get into flexion and extension. Full breath in, full breath out. Breathe and relax into sensations. Feel what's happening in your body. Allow the mind to do its thing. Just keep coming back to your breath as it does that. And just watch. Watch your body open up slowly this morning, one vertebra at a time. All right, we've done 2 movements of the spine. Let's go for 2 more movements of the spine. We're going to, let's do side-to-side movements. So from your table position, we're going to bring the left ear and the left hip towards the left shoulder. This is a little bit of a tricky move, so take this one slowly. You're going to go from side to side, trying to bring your ear towards the shoulder, and also you're bringing the hip towards the shoulder. I'm going to give you a different view of this. I'm bringing my hip and my ear towards the same shoulder. That's on the exhalation. On the inhalation, you come back to center, and then you go over to the opposite side, hip and ear towards the same shoulder. This is tricky because the hip kind of wants to do different things. What you want it to do is you want to stay evenly distributed, weight in the knees, evenly distributed, same in the arms. So see if you can bring that hip over, which is going to be kind of like squeezing your rib cage down on one side. This is going to bring sensations to the opposite side as well as this side. And if you are overhead looking down at yourself, what you would want to see is like a C curve in your spine. Inhalation to the center, exhalation to the side. And just to exaggerate this movement, the next time you go to the right, go ahead and walk your hands over, keep your knees where they are, just walk your hands over and get an exaggerated version of this. You can really feel the sides open up here as you breathe deeply. Inhale, exhale, exhale to the side, inhale, walk your hands back to center, exhale, walk your hands over to the other side. You want to feel that rib cage open up. The oblique muscles connect your rib cage to your hip. And as you walk yourself over to the other side, you really get a good chance to open up that hip. Good. Inhale one side, exhale to the other side. Robin, if you know that you got something going on down below on your ankles, so if you're having an issue, let me know. I can see if I can help you out there. So squeezed, we just did 4 movements of your spine. We just did flexion and extension and cat and dog, and we did lateral flexion with your spine side to side. Now we're going to do a rotation in the spine. So we're going to do a twist. Come back to your table position. Place your right hand directly below your face. If you're looking down at your hand, or if you're looking down, you see your hand. You're going to reach your right hand. Just start it out at, say, 90 degrees, and then slowly rotate up towards the sky with the left hand. Right hand is down, left hand is up. You're trying to open up your chest, and you're keeping the equal distribution in the knees here. So you're not leaning over to one side. If you can, bring yourself back upright and maybe just lower the arm a little bit so that you're not leaning all your weight into one leg. Inhale, reach up, open up the chest. Exhale, feel sensations. Inhale, reach up, open up. And then what we're going to do is we're going to take the back of this left hand right here, place it on the ground beneath or between the right hand and the right knee. And then you're going to slide this shoulder straight down to the floor. But before you do that, just in case, have a cushion nearby. And you're going to bring that shoulder down to the floor. And what you're going to do is you're going to try and place, if you need you may not even need this, but if you do, what you want to do is place that pillow right underneath your shoulder so that you can have a really stable position here with you want about 80% of the weight in your legs, okay? So if you're finding that all the weight's in your shoulder, take the weight back into your hips. Put 80% of the weight into your hips. So if a lot of weight's in your upper body, bring your hips back. And you want to have your shoulder on something so that you can be steady and stable, because there's another move to this twist. This is called threading the needle. Once you're steady and stable in this position, you're going to want to be able to reach your right hand up towards the sky. So you're breathing deeply, you're reaching into your left hand, and you're drawing your right shoulder back as you reach up to the sky, and you can draw some circles on the ceiling with this right arm. Reach way up into the fingertips, the long straight arms, reaching out into the left hand, reaching up into the right hand. Draw some circles on the ceiling with that right arm. Remember to reverse your circles. And when you're ready, you're going to drape the right arm across your back. You got to peek and see. Yeah, you can see this. You're draping the right arm across your back, and you're reaching for the inner left thigh. And just that reaching, you may not reach it, but just the energy of reaching for it is going to draw the right shoulder back as you reach into your left fingertips. And stay there while I tuck my shirt in. All right. So this is a great twist for the spine. You're drawing the right shoulder back, reaching in the left fingertips. Last part is gazing. If it feels safe, you can gaze out over the right shoulder. So you have a complete twist from your sacrum to your crown. Relax your feet, relax your face muscles, relax anything that's not working here. And then when you're ready, you can slowly release the head, release the right arm. Go ahead and bring the right hand down to the floor and slowly push yourself up to a table position. Close your eyes and feel and breathe and relax. Notice the benefits of threading the needle. This is a really great spinal opening rotation. Good for warming the shoulders up. And then we'll move straight on to the other side. So come back to your table position. Let's see, we just did the right arm. This time, is that what we did? We did right arm up. And we did the right arm up. So this time we're going to do the left arm up. Place the right hand directly beneath your face. Lift the left hand up. And then let's open up this side of the body. So that again, see if you're shifting your weight. Wait a second. I think I just did that one, right? We all do the opposite side of whatever we just did, right? I think I just did the right. So let's go ahead and open up. If anybody wants to chime in here, let me know which side I just did. I keep reversing myself so many times. Thanks, Robin.
Yep. I'm threading the needle now with the right.
Right arm up?
No, right arm threading. Yes, right arm up.
Right arm up.
And then right
Thank
arm
you, Robin.
threading.
I appreciate that. Sometimes just, get lost in all this. All right, so right arm is up. I'm opening up my chest and shoulders. Left hand is straight down. Try to keep the weight on both legs. And then the right hand is going to go down. Place the back of the right hand down. Bring that left shoulder down. Use your pillow if you need. Feel the weight, 80% in the back side of the body. And when you're ready, lift the left arm up. And you draw some circles with the left arm. Reverse your circles. And when you're ready, drape that arm across your back. Reach out into the fingertips, draw the left shoulder back. And just as slowly as you did the other side, try to do this side just as slowly. You're gazing out over the left shoulder. That left hand is searching for the inner right thigh. As you draw the left shoulder, left hand is searching for the inner right thigh. I think I just said that. As you draw the left shoulder back. I'm a little dyslexic this morning, I think. I don't know. Reach. It was a long weekend, guys. It was really beautiful outdoors all day long with my chainsaw. Beautiful thing. Reach into the right fingertips, draw the left shoulder back. Relax the face, relax the feet. Breathe into this twist. Feel it open up the body. Notice how in a twist, it's a little more difficult to breathe deeply into the lungs. That's natural and normal because we're in this rotation. Not as much space in the chest cavity. So this is a good place to exercise the lungs when you're in a twist. Really good exercise for the diaphragm. Causes it to work harder so you can breathe deeper. Slowly release the left hand down. Press yourself up, back to table. Close the eyes and tune in and feel and breathe and relax. And watch and allow. Relax and breathe. You want to go ahead, take yourself back into child for a moment. Bring your hips down onto your heels. Bring your forehead down to the floor. Full breath in, full breath out. Maybe just shift your hips side to side. As you get ready, we're going to move straight into a nice relaxing pigeon. So you're going to press yourself back to table.
That's all, folks.